This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly Fantasia, the PhD doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning and happy Halloween. Just in case you're wondering, Dr. Molly is dressed as Dr. Molly, and I'm dressed as me. So that's
I think it's enough, John.
That's exactly right. That's the costume arrangement this morning here on the show. Good to have you with us as always. Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. What's the show about? It's about specifically you and your family and anyone you know, as Dr. Molly will explain, helping you improve your overall quality of life, how she does it, why she does it, and all of that we'll discuss here on the show. And as always, we encourage you to call in if you have a question, 855-839-1210, 855-839-1210. That is the number. Questions, comments, thoughts for Dr. Molly, feel free to call in at any time here on Health Watch on Talk Radio 1210 WPHT. You all set for candy and all that stuff to give out?
No candy, no. John. No candy.
That's right. It's not healthy, right?
Not healthy.
Okay. Let's talk about Innovative Medical. And I was just mentioning that you talk about improving quality of life. Right. And we're going to talk about specific issues later on in the show. But how do you do that? How do you improve the quality of life? I guess
we should start, John, by telling everybody that we have a primary care facility, and all of the cooperating physicians and practitioners work out of my facility. And that is what we do, primary care. But we do it in a different way. We like to limit the amount of pharmaceuticals that are prescribed from the physicians in our office. And we're able to do this by utilizing hydration to deliver the natural products. And why do we want to limit? And actually the philosophy of the physicians there are the same. We want to limit the amount of the pharmaceuticals because in many cases the side effects from the pharmaceuticals are as bad as the condition that brings you in. But make no mistake, if you need an antibiotic, if you need an antiviral, if you need a blood pressure med, we're going to be able to prescribe it.
And you do this via hydration.
Yes.
And a lot of natural products and food sources and that kind of thing.
Exactly.
As opposed to getting a prescription, and then you need two prescriptions to counter the other prescription.
Yeah, just watch TV today.
And then the next thing you got 7 prescriptions.
Right. And
for one problem.
And you know what else? You have 7 times the amount of possibility of side effect. And that's really what we want to limit. People forget that what happens is when you take a pharmaceutical, everything still has to go through the system, go through the liver. And so you want to use your pharmaceuticals in a judicious way. I will never tell you to stop taking your particular problem. What we will do is we'll sit down as a team, look at this stuff, and see if we can reduce, let's say, your blood pressure med. Or maybe what we do is we might add another one, but at a lesser amount, rather than bump you up triple on your dose.
Talk about the natural products and those things that you use in the hydration. You talk about side effects for prescription meds.
Sure.
Are there side effects for?
Sure there
for
are.
In your hydration?
For normal, of course they are. That's why you have to be very careful about your sourcing. That's something that we do just inherently at our clinic. I am very, very particular about the sourcing that I use for the hydration, and that, I believe, makes the difference. But you know and I know. Now, I have a nice gentleman who is my patient who owns a very, very fine health food store. He's very knowledgeable. He's been doing it for 40 years, I believe 40. He can correct me if he's listening, but he's been doing it an awful long time. And I will tell you, he knows his sourcing. He knows good product. He knows what the product does, and he knows when to tell a patient, maybe you don't want that particular product, you want another one. But how many times do you go into some of these chain stores, John, and get that kind of information?
You don't.
Right. Yeah. And most people don't have the knowledge to really be knowledgeable about what to pick up in the health food store.
And that's really where you come into play because of your knowledge, and of course you've developed over 600 protocols.
Right.
We often talk about your protocols,
yeah.
variations. So you've spent years developing this.
I would say 26 this just past month.
Well,
yeah.
you started when you were a kid. Okay.
I'd like to believe that, but I started this because I really saw the need to look at medical hydration and what good it can do and what we could do with it. And I think at the time, I believe we were pioneers in it.
Absolutely. I wanted to ask you, so let's say a person walks into a health food store.
Yeah.
And they maybe have listened to you here on the show, or maybe they just have an idea that they need this to solve a problem. Can they get the kind of, I guess, effectiveness in the health food stores they can get from your hydration?
Well, obviously, the main ingredient of a particular product, they may get some response from the oral product. But how are you going to get what I give you in that bag? How are you going to get that response in that quick of a time? You're not. You can't help it. The product has to go through your digestive system. By the time it gets down to where it has to go, it's probably lost maybe somewhere between 30 to 70% of its effectiveness. And that's if it's a super clean product. If it isn't, you might as well, as they like to say, it's like a drop in the ocean.
Right. So if I buy a bottle of 500 vitamin C pills,
yeah, forget about it.
and it's 1,000 milligrams, I mean...
Not,
I'm getting more than that from a bag, right?
You better believe it. Infinitely more than that. And the idea is you're getting the right extract of the vitamin C. That is very, very important. I believe in God's ingredients, and I believe that with all my heart, that the body knows the difference between manufactured product and God's ingredients that is found in the Garden of Eden, I like to say. It's out there. And so there is a huge difference, John.
So it's virtually impossible to get in the health food store what you're delivering via.
There is no question.
Right.
It's totally different. And it has nothing. Here's the deal. I believe in Goldilocks. We go through this every week.
Right.
Because now all of a sudden they're going to go in and let's say they're buying an amino acid. This is something I see all the time, particularly with guys who exercise very heavily, right? Well, now I need more. I heard Dr. Molly, I'm not getting, no. Because taking too much is better than, or worse rather, than taking too little. And I will tell you, I've seen it happen.
You know, it's interesting because you've had so many patients who come in and say, Dr. Molly, I just don't feel good. And they bring in the substances that they're taking. Yeah. And you look at it, and 5 of them do the same thing.
Possibly,
4 of them are worthless.
Right.
Something, right?
Something
like that,
That's
right?
That's right. And the rest, sometimes, maybe it's the wrong synergy between them. I mean, there's so much that, look, you know how they talk about medicine being the art of medicine? Well, there's an art to natural medicine as well. And that's really what we're looking to do. We really spend time thinking about it. I mean, I really live this, and I spend time thinking about it.
I know you do because I've talked to you often about different things, and when callers call in, they can't see you because it's radio, but I can see your wheels turning when a caller is kind of explaining to you their problem.
Right.
So you think this 24/7.
I do.
The only time you don't is when you're sleeping, right?
Maybe. I think I dream about it. I do dream about it, and I dream about patients. Listen. One thing I know for sure, and this came up this week, and I want to say this, the human connection that my staff and myself, we make with people, you know, in the end, when we stand in front of the good Lord, the only thing we have with us is the love of each other and probably our integrity, whatever that looks like for each of us. And I really live that in our clinic. It's a very healing place.
What can people expect on an initial consultation? We often say, you know, the initial consultation is complimentary, and you do meet a lot of people
sure I do.
who listen to the show. But what can people expect in that?
Well, generally, I like to give people 15, 20 minutes of my time to just get an overview of what's going on, but sometimes it lasts a little longer. And here's the thing. When people come in with a medical mystery, that's what I like to call it, I just don't feel well. And then you just ask them, well, did they bring their blood work? Did they do this? Did they do that? Sometimes they do, sometimes they don't. So what we have to do is put together the puzzle pieces and see, well, how do we help this patient and what can we do? Sometimes it's a little more simple. Listen, I had a patient this week came in with a cancer problem, and that's relatively easy. Horrible for the patient, but relatively easy for us because she even had a definite diagnosis of what type of cancer it is.
Right.
So when people come in and there's a little bit more cloudiness to their problem, it's going to take a little bit more time for us to figure it out. But I will tell you that our whole objective is to make people have a quality of life. So when you come in and you're dragging, I know we can help you.
All right, we're coming up on our first break of the morning. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here. She is the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. You have a question for Dr. Molly? We're going over a lot of things so far, and we have plenty more to talk about here on the show. You have a medical challenge maybe you want to discuss with her, 855-839-1210, 855-839-1210. With Dr. Molly Fantasia, I'm John DeMasi. We return. More of today's Health Watch after these words. And we're back here on Health Watch. Operators standing by, as always, during the show at Innovative Medical. And the number is 856-489-0505, 856-489-0505. You want to have a question answered, or you want to simply sit down with Dr. Molly and go over your situation and have your questions answered? Well, you can set that up. As I said, the initial consultation is complimentary. You call 856-489-0505. And the website, innovativemedicalassociates.com. Innovativemedicalassociates.com is the website. Our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. And if you have a question for Dr. Molly right now, some open lines here in the studio, 855-839-1210. You know, Dr. Molly, we're going to talk about immunity.
Right.
But I wanted to mention to you, Colin Powell, the former Secretary of State who passed away a few weeks ago.
Yeah.
And they said he passed away from COVID, but then he had many other
He had a lot of comorbidities.
Exactly.
Right.
And they said he passed away because of a very compromised immune system.
Right.
Which shows you how important your immune system is.
Absolutely. Absolutely. And it's very delicate. Our immune system is very delicate. And the thing about immune health is people just start thinking, oh, well, it's about feeling good. It's about, feeling good, feeling active, feeling energy, etc. But our immune system is very, very complex. We have various types of immunity. We have an innate immunity. That's the natural immunity that we get. General protection, the body's first response. And what do you think is the biggest organ that gives us our first response? Skin, which is why Dr. Molly developed these particular products along with Dr. Glass, because we were looking at the skin for what it was, the first step in our immune process. We want to keep it healthy because that's our first step to keep us away from viruses, bacteria, etc. You need good hygiene for that as well. Okay?
Of course.
Of course.
But you've often said that the skin is the first defense to immunity.
Right, the first defense. It's the physical barrier to what's going on internally, right? So that's one of the reasons why we develop certain products, including ALA, alpha lipoic acid. Just a side note. But that's innate ability, the innate immunity, okay, the natural immunity, including the skin barrier. We also have something called the adaptive immunity. That's where the T cells, which you hear about a lot with cancer patients, right, keeping the T cells active. They get destroyed over time. How do they get destroyed over time? Exposures, toxic exposures, cigarette smoking, drinking too much, all of those kinds of things. So our adaptive immunity is very, very important. And can something like hydration help the adaptive immunity? You bet. And what you want to use is specific types of nutraceuticals that would enhance the T cell production. Very important in cancer.
You have often talked about passive immunity.
Oh,
what
passive
is
immunity.
that? What is
That's
that?
the short-lived immunity. And the best kind of example I can give that is passive immunity was from mother's milk to baby. Well, that works for a short time, but then baby grows up. And what do we do to enhance or bring back the T cells, etc.? Well, vaccines might be one of the ways. I mean, the jury's out as far as I'm concerned about certain vaccines for certain problems. So what you have to do is you've got to be supportive to your entire immune system. And that I believe we do at our clinic.
And you do that by the hydration therapies that you offer.
Right. And what kind of things help with our immunity? We all know antioxidants. John, you say it every week.
Vitamin C.
Vitamin C. Vitamin C. Vitamin D is another one. Vitamin E, zinc, magnesium, phosphorus. All the B vitamins, selenium. So can I do all this in the bag? You bet. The question is, how do we do it? And for whom do we do it? And how do we use the synergies of all of these things and others?
Besides vitamin C, what else is there to help with the immune system?
Where do you want me to start?
I knew you'd have a long answer. I knew that.
I have a long answer because it depends. Here we go again, John. It depends on what we're trying to do. But in most cases, let's say it's, I'm seeing more and more cancer patients. So, of course, I'm going to look at what types of vitamins, minerals, amino acids are going to help that particular patient with that particular cancer diagnosis. Same thing goes for certain types of what? Autoimmune problems. That's exactly what it says. Now the immune system is in overdrive for some things. So I'm going to look at other substances. So one of the things I want to start out by saying is we don't use everything in every bag. Right? Because I want to customize it for a particular challenge and a particular patient.
What's the most common?
Vitamin C, buddy.
Okay, that's it.
Vitamin C. But the extract is equally as important. You can extract vitamin C from tapioca. You can extract it from cassava. You can extract it from beets. And everybody knows you can extract it from corn. You can also have it made in the lab. Question is, which one of those do you use? And by the way, we have them all in the office. But how do we use it? Obviously, for a cancer patient, we're going to use something that has less sugar.
People have said to me, I take vitamin C. I drink a lot of orange juice.
Yeah,
That doesn't cut it, does it?
No, I don't think so. You're not going to get enough. Plus, you might even upset your stomach.
Right.
So the bottom line is, I'm not. And by the way, I don't want the orange juice people to be beating me up because yes, it's a good source of vitamin C, no question. But the question is, how much of it can you take? You certainly can do better by taking a bag in our facility. But again, I also look at mushroom extract. There you go. How about mushroom extract? People don't realize in cancer care, mushrooms are playing a very, very important role in immune health. It's an immune modulator. So, for example, beta-glucan, you've heard me speak about that before. Yes. Beta-glucan is extracted from a certain mushroom, okay? It's a soluble fiber. So guess what? It's shown in traditional abstracts, it's shown to really slow down cancer growth. How about it?
Amazing. I want to get back to what you said earlier. And people asked you, why did you go from hydration to skincare? Because, as you said, that's the first defense to immunity.
Correct.
Is it a good idea to take your skincare products and use them in addition to the hydration?
Well, you can see I've been giving them out like crazy, haven't I?
Yeah.
Particular ones in particular. And again, it has to do with the extracts. All of our products were made from natural source extract. So, I'm saying to people that what we want to do is we want to maintain our immune system at a top-notch kind of regulation as much as we can given our stage in life. I mean, obviously, look, the older we get, the more what's going to happen to us, the more exposure we have to toxic types of things. That's where environmental medicine comes in, right?
Yeah.
People are exposed to mold and the smoking and the extra fumes and all of this crap. So guess what? You need to then what? Build up your immune system. You think it's good to have cancer diagnosis and then be in a household that smokes? No. Doubtful. What would I have to do in a case like this? I have to call the whole family in and say, listen, we've got to all work together because I can help this patient with bringing up her immune system. But man, we're like, canceling it out with all the extra smoke, etc., and drink and whatever. So again, and what are we eating? Where's our nutrition in all of this? Yes, my extracts are natural source, so it's a nutritional source. Why aren't we eating like that?
And you're talking about taking your hydration with natural sources and then going home and eating hot dogs. That doesn't
no good.
Doesn't cut
Nitrites,
it, right?
No, definitely not. And so, of course, we'll talk about that. And as you know, I work with a couple of really, really good nutritionists, and in particular, one who's very, very smart and actually works hand in hand with me in terms of helping our patient.
Maybe you should give me her number so I could try to eat better.
Yeah, well, I do think you're doing better. You know what's hard? It's hard for a lot of my patients because they're highly functional kinds of people. They're out a lot, meaning their businesses, et cetera, so they eat on the run. And I would say healthcare professionals are like that as well. So guess what? Then you need an extra drip or so.
It's too easy to jump into McDonald's and get.
Well, yeah, that's another whole problem. And the other thing I think is so important with our immune system, in addition to the extracts, and by the way, certain of our extracts have certain substances, including like the mushrooms, that actually have probiotics inherent to them. But we believe in good probiotics because where does most of our immune system start? The gut. And again, when you take orally, what are you doing? You're losing 60, 70% of what you're taking in right through the gut. So really, hydration is a wonderful vehicle to help improve immune health.
What about vaccines? I know that's
you want to put me on the spot.
That's the controversy today. Everybody's saying to vax or not to vax.
Well,
just talk about that in terms of the immune system.
Well, the object of the vaccine is to help the body promote the antibodies towards the particular invader, right? Now, we know right now, I think that we know from the very beginning for our children, there's a push to vaccinate our children. Now, there's a bunch of people. I want everybody to understand I'm not an anti-vaxxer. Please don't have the FDA on my doorstep on Monday because we could. We are not anti-vaccines. But I often wonder about the urgency of inoculating our children the day after they're born with a hepatitis A or something. It seems to me that the babies are not running around doing drug use in the isolates.
Exactly.
So, I mean, I think, what's interesting, John, when we were kids, because we're contemporary, our parents gave us vaccines, right? We had the polio vaccine.
Polio, yeah.
And
that was...
God bless us. I mean, I don't know about you, but I didn't have it.
I didn't either.
But
no.
I've treated people.
Two neighbors had it. I remember that. Yeah.
But I've treated people who did have it, and it's pretty devastating. But we tended to be less aggressive with the vaccines. In other words, you got one vaccine when you were 4 years old. You got another one maybe when you were 4.5. We separated the measles and the mumps and the rubella, if you remember. They were 3 shots back when we were kids. Now they put it all in one. I mean, to me, I'm just a dumb girl, I guess. But when I look at that, I say, well, geez, these kids have little immune systems. Do you think that's why we're having so many problems with kids with ADD, ADHD? Maybe we put them in overdrive. I don't know. I think vaccines have a place in our culture. Certainly they have a place, just like pharmaceuticals have a place, but wouldn't it be nice to have different delivery systems?
Absolutely. Yeah. And with that, we come up on our halfway point of the show. It's Health Watch, Sundays 8 till 9, Talk Radio 1210 WPHT. Dr. Molly Fantasia is here. She is the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. You have a question for Dr. Molly right now? We have some open lines, and we always talk about, you call now, plenty of time to talk to you, and as opposed to calling it 2 minutes before 9 o'clock when we have to leave you. So you know the drill. 855-839-1210, 855-839-1210. With Dr. Molly Fantasia, I'm John DeMasi. More of today's Health Watch after these words. And we're back here on Health Watch. Operator standing by at Innovative Medical Associates right now. You can call them if you want more information. You say you're a little bashful to come on the radio. You can call the operators and talk to them, get some questions answered. And if you would like to make an appointment to sit down with Dr. Molly, that's what you do. You talk to them, and they'll set that up for you. The initial consultation is complimentary. 856-489-0505 is the number. 856-489-0505. Innovative Medical Associates, Marlton, New Jersey. And, of course, the website is innovativemedicalassociates.com. innovativemedicalassociates.com. Check that out. A lot of good information on the website. And the show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPH.D. Our number here in the studio, 855-839-1210. I know, Dr. Molly, you see a lot of people during the course of a week.
Yeah.
And some of the cases kind of upset you. And this was one that was...
This upset me so much, I couldn't even believe it. This wonderful woman who was only in her 60s came in to see me, and I was glad she actually called the day, and I was able to squeeze her in to see me. And I do try to do that, John. If somebody really is in distress and they need some immediate attention of some kind, if only to help them get through a problem,
right,
in the immediate, I try to help. This woman called. She came in late in the day, and she said, "I'm so glad that I'm here to talk to you, because I was at church and I got your name from one of your patients." I said, "Oh, that's great." And she proceeds to tell me she called another quote-unquote medical hydration clinic, and they wouldn't see her because she was exposed to people who had COVID. You hear that?
You're kidding me.
No, I'm not. So she came in, and, of course, we follow the protocol for COVID. We do in our clinic. You know that. I have an air exchanger. I have filters cleaned. I have my ducts cleaned on a monthly basis. I do all that.
I know you do.
And I use good hygiene. And, I have a wonderful nurse who follows all infection control, not just for COVID, but for everything. Bottom line was, I was so appalled because this woman's in total distress. She really needs some help right away. She can't make up her mind whether she wants to go for traditional treatment or not. And timidly, she said, "Would you help me till I make up my mind, or would you not help me?" I said, "Of course I will help you. My whole job is to make you feel better, have a quality of life, and maybe clear your mind and help waylay some of your fear, because the worst thing for your immune system is what? Stress. Stress. And actually, there's an article about that we can reference in a minute. But the point about this thing is, this woman comes in and she couldn't be seen because of COVID. What kind of health care are we doing?
Exactly. Well, she needs you more than anybody, right?
I think everybody needs to know that they ought to be able to get a hold of somebody through COVID.
All right, let's go to the phones. Frank is in the Northeast. Frank, good morning. You're on Health Watch with Dr. Molly.
Hi, Frank.
Good morning, Dr. Molly. Hi,
Oh, that's my favorite patient, Frank. How are you? You're doing okay. I haven't heard from you for a while. Good.
Everyone's your favorite. You're the perfect doctor out there. You are.
You're a nice guy. You're a perfect patient. God bless you. You have a myriad of immune problems. Go ahead.
Well, I got a new one for you. Ready?
Yeah, I'm ready.
I can't get a break, Dr. Molly. It's unbelievable. Just to let you know, the ulcer in my foot's still open. It'll be 2 years in January.
Mm-hmm.
On that left foot, about a month ago, nurse comes out,
Yeah,
I go
to
the
help.
doctor.
Yeah.
Well, anyway, they noticed a red mark on my left instep. So they kept an eye on it. A week later, I went to doctors. She said, "Looks like a ringworm." Gave me cream. It didn't work. They changed it to Lotrozone. Same cream, but started in. It's not working. But last week it spread to my lower back on the right side. And
oh my
a day or two later, now it's going across my whole back. So it's
Frank, did they talk about any oral medication to help stop this in any way, or?
They just put a cream on. I called the doctor on Friday.
Mm-hmm.
They didn't call back. The nurse called the doctor on Friday. She didn't get called back either. She called the doctor 2 weeks before. She didn't get called back either. Tomorrow I'm thinking about a dermatologist, but I wanted to see what you thought about it.
Well, I think that's a great idea. I think that's a great idea. Frank, you have an impaired immune system. So that makes you susceptible to fungus, to all kinds of things like what you're describing. You know that. And I would definitely, if you heard the first part of my show, your skin's your first defense. So obviously something's going on. I can't tell you what it is because I don't diagnose. But I will tell you, you are absolutely right. Be a pain in the neck and call till you get to the dermatology person and someone who's familiar with all the other drugs you're on and your underlying conditions, including the fact that you have a depressed immune system. Okay, Frank?
The dermatologist, I didn't call yet. The dermatologist didn't call me back. I'm working on finding a dermatologist tomorrow. I'm going to try to find one.
Well, you know what else? I would call somebody who has an expertise in immunology, too. I mean, you've got a complex case. Frank, I hope that helps. You're a really nice guy, and I'm sorry you're having all these
Frank,
problems.
thanks a lot for the call.
Thank
we wish you
God
good luck
bless you.
with that. I would just Google dermatologist in Northeast Philadelphia.
I would do something, but I
that's-
find that here we go again. You know, nobody's responsive. Okay, and this is like what I was talking about that poor patient.
Yes.
If you're not responsive to a patient because of COVID or whatever, the idea is you're a healthcare professional. You know how to handle COVID. You know what you need, whether it's gown, mask, but good hygiene, whatever. And you need to make sure that your facility is cleaned up for COVID. And indeed, we do. Indeed, we do.
All right, Al is in Mullica Hill. Al, good morning. You're on
morning,
Health
Al.
Watch with Dr. Molly.
Hi, Al.
Good morning.
Good morning.
I just had a question. My wife has been having a lot of gut issues for about the last 20 some years and all.
Terrible.
And we've been going to a doctor and doing different things, and we would like to get a second opinion on it. I mean,
Sure.
And come out and see you. But can we do a double header? In other words, can we come together? Because I've been
Sure.
doing
Hey,
chelation therapy.
listen.
I've been
No,
doing
we
chelation
don't.
therapy for
Yeah, we certainly will take care of you, Al. Al, listen, we're not running a deprivation clinic where we deprive husbands and wives and people from coming in together. This is all as a result of this damn COVID. I know I can't. It's crazy. You need to come in with her, and I hope she's on a good probiotic. I hope she's taking some aloe, a particular brand of aloe that I would put her on, and I would want to know what the underlying issue is. It sounds like it's a little more complex than just gut.
Well, he said 20 years.
20 years.
Wow.
And I use go ahead.
She's been probed. She's had every test up. Both ends.
Sure. Sure.
And they couldn't find anything. But then we thought maybe doctor said it could be a yeast factor.
Exactly.
And,
some other things
too. She's on probiotics. She's been feeling better, but she says she's starting to feel tired and all. And she don't know if she's taking too many of the supplements or.
Yeah.
We'd like to come in and discuss it. And like I said, I've been doing chelation therapy for over 20 years, and I go once a month. I'd like to discuss that with you too, because I just heard some different things about I could be adding something to the chelation.
Oh, you bet, you bet. Did you have a history of cardiac, my friend, or you just?
Well, that's the main reason why I started, because my cardiologist said you're wasting your money, but it's not going to hurt you. But I've been doing it. I'm still here. I'm 71 years old.
God bless you.
I have extensive heart disease. I got 3 stents, and I exercise. I do treadmill. I'm taking supplements. I'm doing my part, and the man upstairs, and as long as he allows me down here, I'm going to keep on. I work with kids and with drug or alcohol issues for free.
Oh my
and,
God!
I'm a motivational
come in and
speaker,
see us.
I got a lot of living to do.
You bet. You bet. Al, you're a young guy. Listen to me. Come in and see us. We can help you. And you're right. You're right to look beyond chelation. I believe in cardiac nutrition as well. Very, very important. And you can piggyback that right on the chelation. Come and see us. We have a great program.
Thanks a lot.
God bless you, my
and
friend.
If I were you can call the operators right now. They're standing by.
No worries. No worries.
855-839-1210. That's the number here. It's Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Right before the callers, Dr. Molly, we were talking about your patient. and
COVID.
The COVID and the situation. She's got pancreatic cancer.
Right.
I mean, what's the prognosis? How are you going to treat
Well, here's
this?
the thing. We can't diagnose. I can't tell her how. I can only tell her that we can definitely improve her quality of life, regardless of what direction she wants to go in. And we would do this with a particular cancer protocol that might include licorice extract. It might include Jerusalem artichoke. It, of course, is going to include vitamin C at a level, assuming that her blood work comes back and she has the enzymatic number that I need to make sure that the vitamin C can be utilized in a proper manner. That's the other thing that frustrates me. People think they go into these places, just throw them on the vitamin C. Yeah, you can throw them on in a dose that's like minuscule. But when you're looking at using vitamin C as a tool to improve quality of life for cancer people, you need to look beyond that. You want to put them in the chair as quickly as possible and give them an immediate dose. I agree with that. I'd also want to use some of the other things that I just mentioned, including beta-glucan, which would be extraction. So, ALA, alpha-lipoic, and glutathione for sure. So, yes, you do that, but you want to make sure that the patient can utilize the vitamin C that you're using for them. And in a situation with pancreatic cancer, or any cancer for that matter, we want to use a low glucose level of the vitamin C. In other words, we don't want it to have a lot of sugar in it.
Is the goal to boost the immune system
Absolutely.
and improve the quality of life
Exactly.
for a cancer patient? You're not curing cancer.
No, well,
and you've always said that.
We're not curing cancer, but I understand there's a big new pavilion opening up. Maybe they're curing cancer. I don't know. These buildings for all of these places. Look, right where I am, right? All those buildings, it must be 2 miles of buildings down the road from me.
Right.
All of these systems have these beautiful new buildings. Maybe they're curing cancer, and I mean that. Maybe they are. But my experience is that no, what we're doing is improving you so that maybe what they do does get you cancer-free.
Eventually, right,
Yes.
okay. Coming up on a break here, it's Health Watch every Sunday, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. We have a couple of minutes left of the show, which means you still have time to jump in here with a question. 855-839-1210 is the number, 855-839-1210. I'm John DeMasi, your host, with Dr. Molly Fantasia. We are both returning. More of today's Health Watch after these words. Welcome back to Health Watch. Operators are standing by right now at Innovative Medical, and we always tell you that after we leave you at 9 o'clock doesn't mean they go home. No, they stay there. So you can call after 9, 856-489-0505, 856-489-0505. It's Innovative Medical Associates, Marlton, New Jersey. And again, you can call that number now after 9, or that's the number you call during the week. And the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you missed any of our show this morning, or you heard it, you'd like to hear it again, we have our Health Watch replay every Sunday from 4 until 5 p.m. right here on Talk Radio 1210 WPHT, so you can catch us later on this afternoon as well. Health Watch is the show, Sundays 8 till 9, the live version. We're going to go to the phones. We're going to talk to Jim in Wilmington, Delaware. Jim, good morning.
Hi,
You're on
Jim.
Health Watch with Dr. Molly.
Hi, Jim.
Good morning, Dr. Molly. Thank you for taking my call.
No worries.
I have prostate cancer, and it did go to my lymph nodes, but not any further than that. I'm taking Lupron and Abiraterone, and it's making me lose muscle mass and retain water, and the water goes right to my knees. I'm sorry, to my ankles. I'm taking, or I'm wearing the compression socks, and I bought an adjustable bed, and that really helps.
Good. That sounds great. Good. You're doing everything proactively. That's super.
But I'm looking into, protein, I'm reading on the internet, how much
Dr.
protein
Google.
you should take, and
Yeah.
I don't know if it works or if it doesn't work.
Well, look, yes, I think you want to do a few things. For example, I have a homeopathic that I use injectable that I actually give people who helps the drainage from the lymphatic system. You know why you're having the lymphatic issue, because the lymph is the let's put it to you, the lymph is the highway by which the cells drain all of these toxins, etc., and the cancer cells are big. The lymphs really go in action, the T cells, etc. So, yeah, I'm sorry that this has gone to your lymphatics. How long have you had this, Jim, and how old are you?
I was diagnosed like the end of last year, and I started the therapy in January. I just turned 67 in September.
Okay.
Well, my brother, 9 years younger than me, just got it. Now, he doesn't have it. They caught it earlier. I mean, basically because of my situation, they were kind of like, all right, well, we better start checking you out.
Proactive. The most important thing people can do is these cancer screenings. Then you can make all kinds of decisions once you have an idea. And certainly, as I said before, genetics are important, but also epigenetics are important, how we live. The prostate is very spongy as well. You probably know more now than most urologists know about this thing. But yes, there are still some things you can do, and there are still some supplements that I would recommend. Give my office a call. Are you mobile, Jim? Could you come up and see?
I'm very active.
Good.
I don't do it every day, but I'm walking like 2.5 miles.
Great.
Good.
You know what?
And
that's excellent for the lymphatic drain. Okay, that's excellent. You know what? Give the office a call. Come up. I have a lot of people come up and see me for all kinds of problems from the Wilmington area. Give us a call, Jim. I think we can help you with that
thanks
lymphatic
a lot,
problem.
and good luck with that. Let's
God
talk to Betty in Haddonfield. Betty, good morning. You're on Health Watch with Dr. Molly.
Hi, Benny.
Hi, Betty. Thank you.
Hi.
Yes, Betty. Dr. Molly, I am probably going to be your worst patient.
No.
I have quite a few medical problems. I don't eat fish. I don't like mushrooms. I have a hot dog once a year.
Good for you.
I don't know. I'm not a real big fruit eater, so I have a lot of dislikes. But my problem is I have a very rare syndrome called Zollinger-Ellison.
Oh, sure. Yeah, I've heard of that. Tough disease. Talk to me about some of the ways you've been treated at this point. How are you treating yourself? Watchful waiting? Talk to me.
I started out, I had surgery at Fox Chase.
Good.
And they found one of my, I guess it would be a tumor, I don't know, in my duodenal.
Yeah.
And they removed that.
Good.
And then I took
a chemo,
a total
right?
of 8 Prilosec at the time.
Okay.
And the doctor at Fox Chase got me involved with NIH.
Good.
And for 5 years, I went there once a year.
Good.
And they took care of all my medicine because I had no insurance.
Good.
And now their protocol's done.
Good.
And I'm taking a penzethprozole.
Okay. Sure.
I take 8 of them a day.
I'm going to tell you something. I have something that might be able to help you. If you call my office, come in. You're only in Haddonfield. How old are you, dear? How old are you?
I'm 76.
Good. Come into the office. I'm 74. I think from Haddonfield to Marlton is pretty quick.
Not far.
No, come in. I have a couple of things that can help you. Certainly help you with some of the conditions. It sounds like to me that has to impede some of the ability for you to get good nutrition. But I want to say one other thing. You don't like mushrooms. You don't like several of the things. You don't have to worry about that in the IV. For the most part, there is no reaction. Even people who tend to have some type of allergy. It's the active ingredient in these particular things that we have our compounding pharmacist extract. So please give me a call. Come in and see us. You sound like a nice lady. No problem about
Betty, thanks a
being
lot
my
for the
worst
call.
My worst patient. Not a worry.
When she said that, I'm thinking, I mean,
okay.
I've been with you 20 years. I've seen some of the worst patients.
Nah, John.
And you have too.
I don't want to say that they're worse. They're in pain. People who are
exactly.
in pain and worry. Go ahead, John. Anybody else?
No, we're good.
We're good.
Question. We've got a couple minutes left of the show. A question about supplements for cancer treatments.
Yes.
I know you wanted to touch on that. You have about a whole minute to talk about
well,
it.
let's talk about this. There are several supplements that we can use to rebuild your immune system after the cancer treatments as well. So people talk about things. These are all part of like Chinese medicine and things like that. Astragalus is one, okay? That helps increase your stamina. Now, I would be very careful about orally taking astragalus because it can really cause problems in terms of taking other absorption of other medications. So if you've been stepped down to oral chemo or something, we probably wouldn't use or advise you to get astragalus, okay? Another one would be cat's claw. Cat's claw. People are used to using that for things like arthritis, but it actually does help with fight the inflammation in the conventional treatments of cancer, after the cancer treatments, because the body is in an inflammatory state because it really increases free radicals. So you want to use this. You want to use this carefully, okay? Because what can happen? It has a risk of bleeding. So this goes to the question you asked me in the beginning of the show. What are the side effects? You want to use these things correctly. Goldilocks theory,
That's
right? Not too much.
And with that, we put the wraps on another edition of Health
I
Watch.
have more, John.
I told you had a minute. I mean,
Okay.
the minute's up. Sorry.
Okay.
Pick it up next week.
Thank you.
That wraps up another edition of Health Watch. Don't forget, operators standing by. They'll be there well after we leave you at 9 o'clock. 856-489-0505. That's the number. It's Innovative Medical Associates, Marlton, New Jersey. 856-489-0505. The website, innovativemedicalassociates.com. innovativemedicalassociates.com. And don't forget our Health Watch replay this afternoon from 4 till 5 p.m. here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, delightful Dee, fabulous Fran, Joanne, and our nurses Jess and Crystal, and our medical assistant caring Kathy, I'm your host, John DeMasi. Thanks for listening. Always a pleasure. Have yourself a great week. Happy Halloween. We'll talk to you next Sunday. Health Watch, 8 till 9. Talk Radio 1210, WPHT. Take care.
This program is a paid commercial announcement and in no way represents the views of WPHT or its management.